Hi everyone, it's Tower here from TD Aesthetics. So as it's UV Safety Month this month, I thought it would be a good opportunity to do a video about melasma. It's one of the common chronic skin conditions that I think is quite widely misunderstood. So in this video, I'm going to talk about what it is, who gets it, what causes it, the impact it can have on you when you have it, and the treatment options that are available. So let's get right into what causes melasma. As I've said, it's a chronic skin disorder, which means it can appear and reappear constantly over time. It basically is an overproduction of melanin, which is the pigment in our skin that gives our skin the color. And that results in uneven, blotchy, brown areas of skin all over the face and neck and shoulders, and sometimes even down to the arms. So this can present in a sort of typical butterfly formation across the face, where you've got the cheeks look dark brown across the bridge of the nose. The top lip always is an area that's key in melasma, as well as the forehead. So really just uneven brown patches all over the face. So who gets melasma? Well, women tend to be far more common patients of melasma than men. And typically women age between sort of 20 and 45, although you can have outliers at either end of that scale. It's also much more common in people who tend to tan easily. So if you're a Fitzpatrick skin scale of about 3 or 4, which means that when you're out in the sun, you don't necessarily burn immediately, but you do go brown quite quickly, then you're definitely more predisposed to melasma. So what causes melasma? Well, like most skin conditions, it is complex and the causes are multifaceted. It's not a simple thing. It can be genetic, meaning that if you've got someone in your immediate family who also had melasma, you're much more likely to get it. It can be hormonal, which is why a lot of women tend to develop melasma during and immediately after pregnancy and then find it hard to shift that. It can also be hormonal because of things like PCOS, polycystic ovarian syndrome, and also menopause, because we have a lot of hormonal disruption at that time in our lives too. Obviously, sun exposure plays a great part, because the sun exposure is actually working on that melanogenesis and making more melanin to be produced. And there are some medications even that will cause your skin to show uneven brown patches. So what kind of impact does this have on someone who's living with melasma? Well, because it's very visible, it's right there on your face, and it's quite hard to camouflage, because some of the brown areas can be very dark compared to the rest of the person's skin. So it can have a very negative impact because you can't really hide it very well. You can use makeup to camouflage it, but then you end up using quite a lot of makeup, and that in itself makes you feel like you're wearing a mask, and it makes you feel like you're not showing your true face to the world. So it can have a very, very negative impact if you're living with melasma. Which brings me on to treatment. How can you treat it? What can you do to treat it? Well, there are a number of things that will help with melasma. Nothing will effectively cure it, but there are things that you can do to help manage it. And starting with skincare that you can use at home. Starting with SPF every single day, even on cloudy days, because you want to prevent rather than cure. Wearing hats, wide-brimmed hats, to make sure that the sun's rays don't damage your face too much, and just generally being sun smart. Don't go out in the sun at the peak of the day, sort of in between sort of 11 and 3 p.m, 11 a.m. and 3 p.m. Avoid being in direct sunlight without protection, wear SPF every day, that kind of thing. You can also, if you're on medications that are hormonal based, you can ask your GP for alternatives if those are possible. I appreciate that that might not always be the case, for example, with oral contraception. And like I mentioned before, skincare that contains brightening and lightening ingredients, but also ingredients that reduce or disrupt the formation of melanin pigment in the first place. So you're looking for active ingredients like kojic acid or azelaic acid or cysteamine or tranexamic acid, or even glutathione, which can also be given as an intramuscular injection, although that's off license and you would need to speak to your medical or aesthetic practitioner in detail to make sure that you are suitable for that treatment. Other treatments that you can have can be prescription grade treatments, so products like tretinoin or in quite severe cases, hydroquinone. And again, you'd have to go through a medical assessment to make sure that that was suitable for you, because both of those come with other side effects that need to be taken into consideration. And in clinic, you can have treatments as well, like skin peels or microneedling or intense pulse light treatments, but you need to be very careful that those treatments don't trigger a paradoxical post-inflammatory hyperpigmentation, which can actually make the melasma look worse, not better. So in closing, the melasma is a chronic condition. Typically more women than men get it. You get it because of a number of factors, including genetics, hormonal, medication, and sun exposure. There is no cure for melasma, but there are ways to manage it and to make sure that that impact on your life is not as negative as it could be. So I hope this video has been helpful in shining a bit of a light on a sometimes misunderstood condition. If you want to talk to me about what you suspect might be your melasma, or about any skin pigmentation issues, I'm always here and ready to talk to you. Please use the link in my bio to book a consultation or message me direct. I look forward to hearing from you. I hope you have a wonderful day and stay safe in the sun. Bye for now.